Our bodies are symphonies of energy and flow. Every breath, every beat of our heart speaks to the intricate dance of life within us. One of the most crucial aspects of this dance is blood pressure, the force exerted by our blood against the walls of our arteries. Imagine a garden hose with water flowing through it. The pressure of the water against the hose walls is similar to blood pressure in our arteries. Just as that pressure is essential for delivering water throughout the garden, blood pressure is vital for transporting oxygen and nutrients to every cell in our body. This life-sustaining force ensures that our organs receive the resources they need to function optimally, enabling us to move, think, and experience the world around us. Without proper blood pressure, our bodies would cease to thrive, much like a garden deprived of water. Understanding blood pressure is fundamental to understanding our well-being. It is a key indicator of our cardiovascular health and offers valuable insights into our overall health status. To grasp the significance of blood pressure, we must first journey into the remarkable realm of our circulatory system. Picture a vast and intricate network of vessels, arteries, veins, and capillaries that act as the roadways for our blood, the river of life that sustains us. At the heart of this system lies the heart, a tireless pump that propels blood throughout our bodies. With each rhythmic beat, the heart sends oxygen-rich blood surging through our arteries, carrying life-giving nourishment to our cells. As blood travels through this intricate network, it exerts pressure against the artery walls. This is our blood pressure. This pressure is not constant, but fluctuates with each heartbeat, creating a dynamic rhythm that reflects the ebb and flow of life itself. Just as a river's current is essential for transporting nutrients and sustaining ecosystems, blood pressure is essential for delivering oxygen and nutrients to every corner of our being. As our heart beats, it creates a rhythmic pulse, a surge of pressure that propels blood through our arteries. This rhythmic fluctuation is reflected in our blood pressure readings, which consist of two key numbers: systolic and diastolic pressure. Systolic pressure, the higher number, represents the pressure in your arteries when your heart beats and pumps blood out. It's the peak force exerted on your artery walls during this active phase of your heartbeat. Diastolic pressure, the lower number, represents the pressure in your arteries when your heart rests between beats. It's the minimum pressure maintained in your arteries, ensuring a continuous flow of blood even when your heart is not actively pumping. Think of it as the difference between the crest and trough of a wave. The systolic pressure is the peak of the wave, while the diastolic pressure is the low point between waves. Both are essential for understanding the overall dynamics of your blood pressure. Section 4. The silent threat. Normal versus high blood pressure. Just as a gentle breeze is preferable to a raging storm, maintaining healthy blood pressure is crucial for our well-being. But how do we know if our blood pressure is within a healthy range? A normal blood pressure reading is typically around 120 over 80 millimeters of mercury, though this can vary slightly depending on age and other factors. This indicates that your heart is pumping efficiently and your arteries are healthy and flexible. High blood pressure, also known as hypertension, occurs when the force of your blood against your artery walls is consistently too high, like a persistent strain on the delicate walls of your arteries. This relentless pressure can damage your arteries over time, increasing your risk of serious health problems. Hypertension is often called a silent killer because it may not produce noticeable symptoms for years, even as it silently damages your arteries and increases your risk of heart disease, stroke, and other health issues. Section 5. Lifestyle's impact. Factors influencing blood pressure. Blood pressure is not a fixed entity, but rather a dynamic force influenced by a multitude of factors. While some factors, such as age and genetics, are beyond our control, others are directly tied to our lifestyle choices, empowering us to take an active role in managing our blood pressure. Our diet plays a significant role. Consuming a diet high in sodium, saturated and trans fats, and cholesterol can contribute to high blood pressure. Conversely, A diet rich in fruits, vegetables, and whole grains can help lower blood pressure and promote overall cardiovascular health. Physical activity, stress levels, sleep quality, and even our social connections can all influence our blood pressure. Leading a balanced lifestyle that prioritizes regular exercise, stress management, adequate sleep, and meaningful social connections can positively impact our blood pressure and overall well-being.